Our minds are such a powerful thing. They control not only our thoughts, but sometimes different physiological processes within our body without us even realizing it. This week, guys, we are talking about the power of the placebo effect and how we can use that to shape our everyday lives.
Whether you think you can or think you can't, you're right.
Oh, I love it. Yes, it's so powerful because you're so true. You know, when it comes to what we want to do, what we need to do, we are able to control the outcome based solely on our beliefs of what's going to happen and what that outcome is going to be.
Yeah, and then honestly, when looking through some of the studies, it's kind of like magic. Like when you think about it, the power of your mind, if thinking some way, or if you're thinking like placebo, for example, placebo is when you're given something and you're told, hey, this is supposed to lower blood pressure, or this is supposed to make you happy, and you take it and it's actually just a sugar pill, right?
Right.
And we've looked at so many studies, but when you think about that, it's crazy that you actually have physiological effects on the body, physiological changes within the body when it's a placebo, when it's something that is absolutely pointless.
Right, exactly. And so, as John kind of mentioned, first we're going to define placebo. So, a lot of times when the term placebo or placebo effect, it's really in a research study when they're trying to see is something effective? Is this drug or this medication or this treatment procedure effective? And the best way to find that out is to do a blinded or double blind placebo controlled experiment. So, what that essentially means is you have one large group of people, so let's say 50 people, you split it down in half 25 and 25. 25 of the people get what you're actually trying to administer. So, John mentioned a blood pressure medication. 25 actually get the pressure medication. They're educated, hey, this is what the blood pressure medication is supposed to do. You're at risk for high blood pressure. It's supposed to lower blood pressure, lower your risk of cardiovascular disease, X, Y, and Z. The other half of the people are given the same blood pressure medication. They're told the same thing. Hey, we're giving you this blood pressure medication. You're at risk, blah, blah, blah. Except that half of the group is actually just given, as Sean mentioned earlier, usually it's a sugar pill. It's something that should have no effect whatsoever on that individual's blood pressure. And at the end of the study, they find that the individuals that got the blood pressure medication and the individuals that did not had either similar or not so similar results. So they can say, hey, this medication actually does lower blood pressure and it's not, it's the right formula, it's the right this, it's the right that. So for a while, the placebo was seen as kind of like a negative thing. If the placebo worked, people were like, oh my gosh, like our blood pressure medication doesn't work. Like
Yeah.
we need to go back to the drawing board. But now people are starting to realize, like, wait, we could be unlocking something huge. We could be using individuals' own knowledge of what's supposed to happen to actually make things happen in their bodies. So, that's kind of the definition of what a placebo might be. There's different times. So sometimes it is a minister of a drug. Sometimes it's, you know, effects of a procedure, or it's, what different meanings of colors may be, or it's what different responses of things you do every day should and shouldn't be. So it's kind of like a big overcompass of a lot of different things, what a placebo is.
Yeah, and I know that we're going to touch on a lot of different studies, but the one I was looking at this morning actually talked about the probiotics and
Okay.
the gut microbiome. Gut microbiome is a big
Yes,
hot
buzzword.
topic, yeah, in the last 10 years, honestly, and we just know how important it is. We've talked about it for mental health, and that's exactly what the study in 2019 was trying to look at. And they gave half the participants a placebo, and they gave the other half a probiotic, and they kind of told them that this probiotic actually has bacteria in it that supports um, your mental health, right? And it supports happiness and just overall serotonin, dopamine, stuff like that. And all these people who suffered from depression, the probiotic group, there was like a moderate to high increase in happiness and a decrease in depressive symptoms. But the placebo group also showed a moderate. It wasn't as high, obviously,
Right.
as the
Yeah.
probiotics. They did talk about some specific bacterium that the patients got that actually really showed increase in happiness. But the placebo group, a moderate significance as far as an increase in happiness and a decrease in depressive symptoms. So basically, just a placebo telling somebody, hey, if you take this pill,
It's going to make you happier.
it's going to make you happier. And it's actually not doing anything, but it is doing something because it's that mental aspect of it. So you're actually seeing the psychological and the physiological results.
Right. And that's, what I think is so cool is a lot of studies in the beginning were saying, oh, a lot of these could be self-report, right? You're reporting your depressive symptoms in the beginning and you're reporting your depressive symptoms at the end. You're reporting your pain in the beginning, you're reporting the pain at the end. So you don't really know. Maybe people are just like, yeah, I think I feel happier. I don't know. Like, I'll just check off I feel happier. But studies now have actually been able to scan the brain and they see that different areas of the brain that are associated with those feelings of happiness, with decreased pain, with increased motivation are lighting up in the brain.
So it's more of an objective result that's actually showing that they are happier rather than just that subjective, like, oh yeah, like I'm part of a study, the before and after, like,
Right,
oh, are you
right.
happier now? Yeah, I'm
Yeah,
happier. That's a great point.
exactly. So I think that was so amazing to hear and see. And like I always say, we reference these studies in you know, the show notes and we can put also pictures of some of these brain scans because it's so cool to think that, you know, nothing can have such a powerful effect on the body.
Yeah, and when you think about it, if you're having a rough day or something, and we've heard this before, where if you go and look in the mirror and smile and just tell yourself that you're having a good day and tell yourself that you're feeling good. Obviously, we understand that um, it's not always going to be 100%. You're not going to go from a 1 out of 10 to a 10 out of 10.
Right.
However, there, like you said, there are that psychological and physiological response when you're smiling, and you start feeling happier, and you can see it in the brain scans, and it's crazy.
Yeah. Just think of like, as John said, if you're walking down the street and you are walking past all these people and they're straight faced, they're not saying anything, like, how do you start to feel?
No,
How do you
it's
start
yeah.
to how do you start to think? How do you start to act? You're like, maybe there's something wrong with me. People, maybe like I'm doing something wrong. Maybe it's okay to just be upset versus if you just get a smile or you smile at someone and they smile back. And then the difference between just that one facial expression can really change your whole entire day.
Mhm.
And that's kind of exactly why I wanted to talk about this topic today, John, is because you can be the placebo of your own life. You have that ability to change and do things in a different light and in a different way and be the placebo. I do want to talk about one before we get deeper, one study in the New England Journal of Medicine that looks specifically at knee osteoarthritis and a specific type of knee surgery. So they actually did this study because they wanted to see which part of the knee surgery was more effective. So they had a full surgery group, a half surgery group, and then a placebo group. Each group went and did the same thing, right? They went in for the surgery. They heard the noises of the surgery. They saw the incisions from the surgery and they watched a video of the surgery being performed on the screen. Except the placebo group, they didn't actually get the surgery. They got the cuts. They heard the noises. They saw a video of someone else's knee surgery and
Wild.
they came out of it with decreased knee pain.
That's insane.
That to me just blows my mind.
Yeah, no, I did not believe that when I first heard it. But looking up the study and reading about it, I agree. It's crazy. But honestly, at the same time, as a physical therapist, and you're an OT, so we're in the field a lot, and we see a lot of people with knee pain. It does kind of make sense,
Yeah.
if a lot of people just like, oh man, I just got to get the surgery,
Right, right.
and
They
some,
think that that's going to fix them.
yeah, and sometimes, especially with scopes, not a lot is being done,
Yeah.
and yeah, it's crazy, but actually, objectively, they are having less pain, which is wild.
Right, exactly. So, that's why it's so important sometimes to really, I want to say, like, listen to all the treatment options and listen to what your doctor says, what your physical therapist says, what your health provider says, because sometimes we're so stuck on one thing, right? Like, I know that I need this medication, and this medication alone is what's going to help. And our doctors sometimes want to maybe try different things. Maybe they want you to go to physical therapy before you get your surgery and see if that's going to help. And if
Yeah.
they're dead set on getting that surgery, is physical therapy going to help, John?
Absolutely not. It's a great point. And that's again power of the placebo. So power of the mind. If you come into physical therapy or if you go into anything and you're like, this is not going to work,
Right.
then you're right.
Yeah,
It's not going to work. But if
exactly.
you keep that open mind, like, hey, hopefully this will work and this is going to work, and I'm going to give it my all and try everything I can and listen to my physical therapist, which 75% of people do.
Right.
Obviously, not everybody, but it does work a lot of the times. And a lot of times they don't need surgery. And
Yeah.
they, I mean, I've had a dime for every time someone said, wow, like I did not think that physical therapy would help me, because it's ingrained in everybody's mind that it's medication or surgery. Like that's what's going to help my pain. Like exercises and different physical therapy interventions aren't going to work.
Yeah.
And if you think like that, again, with anything in life, it doesn't have to just be physical therapy.
Right.
If you go into anything that you do with a negative mindset, like oh, I'm gonna miss this shot, then you're gonna miss.
Yeah.
But if you
Exactly.
think like, hey, I'm gonna make this, you have full confidence, or if you believe in something, then uh, more than likely it's going to happen.
Right. And that's what's like so powerful and so amazing about these things is, it really does take just your thought, and it can produce action, and it can produce the results you want. So another study I looked at talked about the meaning and the effects of different colors of pills. So they looked at, individuals who wanted deeper sleep, and they said, they broke the people into three groups. They said, this is a sleep medication. It's going to promote deeper sleep. They gave one group a blue pill, one group a red pill, and one group a green pill. All of the pills were supposed to have the same exact result. However, at the end of the study, the individuals that got the blue pill reported increased deep rest compared to the individuals that got the red or the green, yellow, I forget which one, pill.
Yellow.
Yellow, okay.
Mm.
And it is because blue is associated with a little bit more of a calming color. Blue and purples are more calming. Reds are a little bit more energetic. And then yellows are a little bit more like happy.
Hmm.
So they repeated the study with depression, and they gave same thing, the spiel, this pill's supposed to make you feel better, supposed to make you happier. This time the individuals that got the yellow pill reported higher levels of happiness and decreased depression.
Wow, that's why this red yellow dye is just so great. That's why they throw it in there. They gotta
Oh
get the
yeah,
colors.
yeah, yeah, yeah.
But yeah, no, I mean
Because if
that's
you drink a a blueberry drink and it was
gray.
yeah,
So yeah,
clear,
yeah,
you'd be like, this doesn't taste like blueberries. But
exactly.
man, you dye it bright blue
It tastes
with
exactly
blue
the same.
10,
Yeah, it
it is
tastes.
it tastes exactly like blueberry.
Yeah,
So there is going to be a little bit of a change for I know it's not coming up anytime soon, but red Gatorade, I don't know what they're going to do. But actually
yeah.
have to
I
put
mean,
like beets or something in it.
yeah, they got 2.5 years to figure it out, which is doesn't make much sense.
Right. I know.
Anyways,
All good. Getting back to the placebo effect.
yeah. No, I mean the power of the mind. Again, that's just another example. Different colors having different results, and really at the end of the day, it's just a placebo.
Right, exactly. And I think that it's, again, your perception of what's supposed to happen, whether it's based on knowledge, whether it's based on a color, whether it's based on a feeling, your knowledge of what's supposed to happen increases the likelihood of that is going to happen. So I think that that's why we can tie this into like everyday life. Like your example of making the shot is perfect. If you go into things with confidence, if you go into things saying, this is going to make me feel better, or I'm just going to go in feeling happy. And if I go in feeling happy, that my depression's going to, again, not necessarily decrease altogether, but can it get a little better? Can some of those symptoms start to decrease? Can you start to feel a little bit better and therefore make those connections with other people and live that life that you want and you deserve? And I think that that's what's so important, is finding a way to implement the placebo effect into your everyday life and into your interactions with others and into your conversations, and be speaking a little bit more, upbeat and a little bit more knowledgeable, because really what it boils down to, as I was saying, is that it's the knowledge of what's supposed to happen that truly makes it happen. People aren't just getting this pill and saying, here, take this, it's for your blood pressure. They're being explained most of the time that this is the effect that it's supposed to have on your body. And as we mentioned, the brain is having that effect, or the body's having that effect. And those people are feeling better and they're feeling different. And the opposite can be said. There's such thing as a nocebo effect. So you could, have a negative thing be brought upon you. So for example, if I said, oh, Jon, like those freckles on your arms, they look like cancer. Pretty good chance you're going to get cancer here soon. Individuals who are told that they look like that they might have cancer have a higher incidence of getting cancer down the line.
Wow. Well, take it back then.
Yeah, no, I'm just joking.
Okay.
Your freckles are beautiful.
Thank you.
But it's things like that. Like if you go into a doctor's office and,
Yeah, and they diagnose you with, I mean, again, like arthritis and just these like terms that people are like, oh, I have arthritis, like it's cancer, like it's Parkinson's or something, like, oh, you have arthritis, like you got some inflammation in your joints, like
right.
a lot of them think like it's the end of the world, and oh, you're diagnosed with anxiety and depression.
I think that's probably the biggest one.
Exactly, like status, like after a big life event, oh, you have anxiety and depression, so now you need to take this pill. Or kids that are diagnosed with ADHD or
Right.
whatever because they can't pay attention because they're 8 years old or 10 years old. So like, oh, let's give them a pill. It's like,
And they're told the rest of their lives they have ADHD and that they act a certain way. Of course, they're going to continue to act that way.
yeah, no.
And
then it just gets to the point where it's like, oh, if I don't have a pill or if I don't have something, then I can't do it. Like, no, you can. You can get over it. You can do whatever you set your mind to. And like, obviously, that's super cliche, but it really is true. I mean, it's shown in the studies that you don't have to be on different pills. Like, you can mentally get to that point where you don't need it, and you find other things, whether it's, for example, cold exposure, right? If you're like, oh, like I'm super depressed or something, and then you start doing some like cold plunges or something and you feel much better afterwards, yeah, you're getting that dopamine hit. But also, hey, maybe it's a little bit of placebo too, like
exactly.
I'm doing this, it's making me feel better. That's really all that matters at the end of the day.
Exactly. That was beautifully worded, because that's it. As Jon so wonderfully said, if you believe you can, you can. If you believe that you can't, then you can't. Either way, you are deciding what you are going to let someone's words, someone's actions, define you or make you push yourself and be better. And I think that that's what is so, valuable in today's society where, as we mentioned, we really do take sometimes what even other people that are our friends and our family say so dear and personally to our, hearts. And we're not saying that those individuals, are wrong or are meaning to do things, but it's truly like what you believe and what you are going to let define yourself, and that's why the brain is so powerful. If you start to give it some negative vibes, it's going to pick up on those negative vibes. And if you start to give it positive affirmations and love and self respect, you're going to start to feel that same wavelength within your body. And I think, this is like kind of going in a different direction, but we see that too with like mental rehearsal, right? When an individual is performing a sport or specifically like a musical instrument, and you close your eyes and you can see yourself shooting, or you can see yourself playing the violin or the guitar or whatever, your brain is picking up on those movement patterns. And they have also done brain scans on that. And they've seen that, hey, the part of the brain that you need fine motor coordination to move your fingers really quick on the piano, it's actually activating more. And even though you might have not touched a piano, you're getting some of that response. So that's why it's so important to think positive thoughts, to like imagine how you want to feel, how you want to act in a situation. And I think that's what's hard. I heard this the other day and it was like, well, how, you want to be like, I don't know, say Bill Gates or something like that, which could be controversial. I don't know. You want to be like Bill Gates. How do you think Bill Gates, wakes up in the morning? How do you think he talks in a business meeting? How do you think that he presents himself? Like, does he go there being like, oh, I don't really know what I'm talking about? Like, no, he goes in there like, this is how it's done. This is what I want, by trying to encapsulate someone you look up to or someone that you want to be like, you are starting to give your brain that feedback of that's who you can be and that's what you can do. And I think that that's what's so cool about our bodies and about some of this research that's coming out on how we can use the power of the placebo to make us better in everyday life and to make us feel better and to make us, do better things and be better people.
Yeah, no, I love it. And like I said, at the end of the day, whatever is your thing. So whether it's placebo, whether it is does have that science backed. I mean, we talk about a lot of different things that we do. Obviously, we talked about the scanning things with the Yucca app, and
Yes.
again, power of the mind. If we go into it and we see a couple red things or yellow, on the app, and we're like, oh, this is terrible for us. This is going to give us cancer. This is going to give us this or give us that. Then it's a higher likelihood that that's going to happen. But if we're like, hey, we can control what we can control, we're not going to stress about it. This is good for me, then it is going to be good for you.
We'll talk about that with food,
Yeah.
right? Like sometimes again, I don't think there's been studies. I can't quote them, I
No,
can.
the milkshake study.
Right, the milkshake study.
Yeah, where they were all exactly the same amount of calories, the
Yep.
same amount of protein, fat, sugar in all of the milkshakes, but they gave one, group, and they said, this is a slim, healthy smoothie that's, supposed to help you get fit, and then they gave the other group, and
Well,
they
they said
said,
it was like 100 calories. And then
oh,
the
and they
other
told
group,
them,
yeah, they
okay,
told
and
them it
then
was
they told
100
them
calories.
the other group that it was a 500 calorie, milkshake,
Indulgent,
exactly, from Dairy Queen or whatever, and they took blood, and they, and this group over here that got the healthier smoothie actually had better results as far as whatever they looked at as far as
yeah.
insulin and everything
Well,
like that.
and I think they looked at mainly hunger levels.
Yes, yeah. So that
So
they were
they
full.
were,
No, they were fuller.
yeah.
The
So
calories.
the individuals that got more calories reported being fuller versus the individuals that got less calories. They reported being hungry, like they wanted more, even though the individuals got the same exact milkshake.
Yeah. So if you think exactly, yeah. I mean, again, with obesity nowadays, if you think like, oh, I,
I think that's
only
the
had,
thing. Oh, I only had 100-calorie snack pack of chips.
yeah,
I'm still hungry. Versus sometimes you don't realize how much you're eating when you're just going straight from the bag and you're eating so much,
Yeah, and
you know?
you're eating hot pockets and peanut butter and jelly sandwiches. Although that does sound kind of good. What are the Uncrustables?
The
Those are good.
Uncrustables, yeah,
Definitely not good for you.
definitely not.
Yeah,
I'm sure they're low rated on that Yucca app.
yeah, we gotta scan it because man, I used to eat those a lot.
Yeah,
But yeah, so it,
exactly.
it
So it's the power of the mind. That's what we're trying to say, and it's so important to just remember that, that you are in control. You are in control of the choices you make, the way you think, the way you act, the way you interact with others on a day-to-day basis. And if you give yourself positive feedback and you give yourself love and compassion and you're grateful for all the things you have in your life, your body is going to thank you and your brain is going to show that. And the same can be said if it's the opposite way, and it's all about the knowledge that you're provided. And I think there's just two more quick studies I want to talk about because they talk it's a little, different than what we said, but it's still on the placebo. There was one study that was conducted and they looked at wound healing, and all the participants were given, a small, not like anything crazy, small cut, and they were set in a room. There was like they put a little ointment. Everyone got the same little ointment on the wound, and they had a clock on the wall. And one group's clock was going slow, one group's clock was going normal speed, and one group's clock was going faster. And they were able to see that the group clock that went faster had increased healing rate. So those individuals thought because more time was passing, that more healing was happening to their wounds.
yeah. Again, it's one of those studies that you hear it and you're like,
Nah, but
there's
it's true.
absolutely no way. Yeah, I mean, show notes down below. Like, comment,
Check them
check it
out.
out.
Check
Because
it out.
I mean, that's literally magic. It feels like magic.
It is.
Yeah,
You can be magical,
yeah,
and you love magic.
I do.
You know, so that it's just so cool. And then the other one I wanted to talk about was why am I blinking out on it now? This is
Placebo.
embarrassing. I know.
Placebo, power of the mind.
Placebo. Oh, okay. Yes, thank you. It had to do with effects of exercise. So they were looking at, do the effects of exercise, are they like you can only get them from rote exercise alone? So they took housekeepers who do, daily, kind of moderately vigorous daily work, and they broke them into two groups. The one group, they said, this work is valuable. You do this work because it's good for you and it helps out the business, and we really appreciate it. And then they told the other group, these activities that you do every day, lifting, pushing, pulling, moving at a faster rate, they are almost identical to exercise. And here are the benefits of exercise, decreased blood pressure, increased insulin sensitivity, increased muscle mass, increased cardiovascular endurance. And that's why it's so good that you should, be doing this work. At the end of the study, they looked at all those biomarkers. The individuals that were told, that they're doing a good job and that it's important, they had no changes in muscle mass, cardiovascular endurance, um, insulin sensitivity, or blood pressure. The individuals that were told that all had, positive outcomes, whether it was decreased blood pressure or, an increased insulin sensitivity than at the beginning of the study. And it was just because them doing the same things, but they were told that what they're doing has positive effects on the body. They didn't change the way they were doing it. They were doing it exactly the same.
Yeah.
And it's just so amazing to see. And a lot of these studies are controlled. So sometimes you could say, like, oh, well, what if they really were working harder and you didn't realize? Or maybe they started going to the gym and you didn't. But a lot of these studies are controlled to take out extra variables like that. And they want to see, like nothing else, is this making a difference? And it was,
Yeah.
So I think we talked on so many great studies and so many great things that you guys can really, just kind of take through the rest of the week, through the rest of the month, through the rest of the year, right? It is still the first month of 2025. I accidentally write 2024 on some of my documents, I know. It's bad. I have to scratch it
It's
on and rewrite it.
2025.
I know. But so you still have so many months left of the year to make a difference, not only for yourself, but for those that you love and you care about. You yourself, guys, are the placebo. Think of the power of the placebo in your everyday thoughts, actions, and interactions with those around you. So, John, what are we going to tell them to do this week?
Let me think about it. Yeah, so think about your everyday life, whether it's work, relationships, whatever it is, and think about how mentally you're thinking about that. So going into work, oh, I don't really like this
Hate this.
coworker, or I don't like this specific thing that I have to
Love
do at
it.
work. Try to go into it with a little bit different mindset. Just use the power of your mind. Use it to your own advantage, like Courtney said. Try to find one thing this week that you can put the power of the mind to work and see if it works out for you. See if you go in and you're like, hey, may I feel a little bit better afterwards, or hey, that wasn't as bad as I was making it out to be, or he or she isn't as bad as I, made them out to be, or maybe they are. So, but go ahead.
If it doesn't work, then we're called the Model Health Show. My name is Sean Model. I'm just kidding.
No, it's gonna. I mean,
it's gonna work because
exactly.
you believe it's gonna work, and it's gonna work. If you
Yeah.
go in and you're like, I'm gonna do it, even though I don't think it's gonna work, then it's not gonna work. So
Yeah, exactly. There's a difference between believing and doing.
exactly.
So
I could bring out my Santa Claus quote, but I won't.
yeah.
So thank you guys so much for tuning into this week's episode. We are so excited to get back on like weekly, bi-weekly basis back in St. Pete. Life's a little more hectic with friends and family, but we love it. As always, if you have any questions, comments, please leave them below. As John mentioned, like this episode, make sure you're subscribed because we want to hear from you. What do you guys want to know? What do you want to hear on the podcast?
Yeah, we got studies for days, hundreds, thousands of studies ready to go. Let us know what you're into as far as health goes, as far as wellness. If you're in, more into that exercise, if you're more into like the food aspect, we have a lot of ideas coming up, and we're really excited.
I haven't told John, but I feel like we got to do one on like love, relationship, affection, with Valentine's Day coming up.
That's a really great idea.
You're picking up what I'm putting down, so that might be on the horizon.
Let's try it out.
So you guys have a great rest of your week, and we'll see you later.
Peace.